The first page of your nervous system notes looks like this, and this is just an outline of what's happening with your central nervous system. When we look at our central nervous system, when you look at your total nervous system is all about communication and control. Control within your body and controlling your response to stimuli that comes from outside of your body. Your nervous system is divided into central nervous system and peripheral nervous system. Your central nervous system is your brain and spinal cord. CNS is how we abbreviate the central nervous system. And the central nervous system is all about processing information. It's about thinking and interpreting the stimuli that comes in from the outside as well as stimuli that comes in from the inside. The peripheral nervous system are the lines of communication between the outside and the central nervous system and then back outside. So with the nervous system, you can't just have the central nervous system. You can't just have the peripheral nervous system. You have to have them both to have our bodies work. Now, our central nervous system is comprised of your brain and your spinal cord. About 95% of our central nervous system is our brain. And our brain is all about calculations, emotion, thinking about emotions, and memory. Do you remember how you feel? Do you remember how you thought? Do you remember how to calculate that pre-cal problem? All that is happening in the brain. Now, the spinal cord is like 5% of the central nervous system, and the spinal cord is all about reflexes. The spinal cord, and I'll show you a picture in a minute, connects the central nervous system to the peripheral nervous system. And we'll go here. I'll show you what I mean. We go to this slide. So you all know what a reflex is, and maybe you've done the patellar reflex here, where the doctor hits you on the knee and your reflex is to kick, or maybe you have been poked or cut. That information goes into your spinal cord, comes here through this interneuron or this association neuron, and then goes out back to the effector organ, in this case the muscle, for the muscle to move. And this is called a reflex. The information goes in and comes right back out, and it doesn't go to your brain first. There are other reflexes. There's the rooting reflex that we experience about 3 to 4 months old. The infant will begin to nuzzle mom and move his head like a pig would in the dirt. The sucking reflex is pretty instantaneous. You stick anything in the mouth, might be a finger, it could be a nipple, but the infant already automatically knows to suckle. You can touch the baby's face, and they will turn their head to that direction and open their mouth. So if you touched him over here, he would turn his head left and open his mouth that way. The Babinski reflex, or the Babinski reaction, occurs in babies up to 1 to 2 years. And what happens is when you rub the bottom of their foot, their toes spread out and fan out. Now, normally in adults, when you rub somebody's foot, their toes should curl under. And a physician will know that there's a neural damage if, as an adult or a child, a 5-year-old kid or a teenager, if you rub the bottom of their foot and they demonstrate the Babinski reaction. That tells the physician that there's nerve damage there. Pupillary light reflex, you can't control it. You have bright lights, your pupils get really small. Turn the lights off, your pupils get really big. And like I said, it's a reflex. You can't control it. The gag reflex, I'm sure we've all experienced that. You pet a dog. Some dogs, you have a certain spot where you pet them and then they just scratch, 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 scratch. They can't control that. Those are all reflexes. And like we mentioned, the patella reflex. So you don't have this picture yet, but just understand that the information comes in, goes through the interneuron in the spinal cord, and then the reaction goes right back out so that the change can be made. As I said, reflex, you can't control them. So maybe there's a loud sound that your ears pick up, and that signal goes through here, and your reaction is to jump. Or maybe your bratty little cousin comes behind you and, scares you, yells real loud. That stimulus comes in, goes through your spinal cord, and your reaction is to knock him upside the head. You can't control that reflex. Okay? And that is all part of the central nervous system.